Dr. Prachi. Today we are going to have a quick recap on the diseases of the external nose. CHOANAL atresia. There is persistence of the buccopharyngeal membrane which leads to CHOANAL atresia. It is bony in 29% of the patients and mixed in 71% of the patients. Pure membranous CHOANAL atresia is generally not present. If there is an inability to pass a 6 French catheter to the nasal cavity, then it is indicative of having a CHOANAL atresia. Patients who have difficulty in breathing at birth, they are generally tested with this to know whether the patient has a CHOANAL atresia. The patient has cyanotic events which are broken by crying. This is important because in CHOANAL atresia, the children are primarily nasal breathers. If both the choana are blocked, then the patient is not able to breathe. The patient will have cyanotic episodes, and when the patient starts crying, that is when the patient opens the mouth and starts breathing, then the cyanotic episodes are settled. It is reversed with the help of McGovern's nipple, that is, the nipple has holes in it so that the patient can actually breathe through the mouth. The patient with bilateral choanal atresia requires emergency surgery, in which the surgery can be done with the help of an endoscope, with a sublabial approach or a transpalatal approach. Unilateral choanal atresias are generally underdiagnosed and they are generally not noticed when the child gets elder. So, this is how the choanal atresia looks like. In this, the nasal passage is blocked. Saddle nose. As you can see, it looks like a saddle on the horse. In this, there is a depressed nasal dorsum. It can involve the bony, cartilaginous or both the parts. The etiology involves nasal trauma, excessive removal of the septum in the SMR, destruction of septal cartilage by hematoma, abscesses. Leprosy, TB or syphilis can also lead to saddle nose deformity. The treatment involves augmentation rhinoplasty by filling the dorsum with cartilage, bone or a synthetic implants. A saddle nose will be corrected like this. Hump nose. This looks like a hump of a camel. It involves the bone or the cartilage or both the parts. It is corrected by reduction rhinoplasty, in which the hump is removed and the narrowing of the lateral wall is done to achieve a straight nose. Congenital lesions involve dermoid cysts, which are of two types. A simple dermoid, it can occur as a midline swelling under the skin but in front of the nasal bones. These are all the dermoid sinuses, and a dermoid sinus can have an opening which is indicative of having a dermoid sinus. Encephalocele or meningoencephalocele. In this, there is herniation of brain tissue along with the meninges through a congenital bony defect. The important sign is the Furstenberger sign. Bilateral compression of the internal jugular vein leads to increase in size of the mass. This is the Furstenberg sign, which is positive in meningoencephalocele because on compression of the IJV, the intracranial pressure rises, which is transmitted to the meningoencephalocele. The patient will have cough impulse also because there is transmission from the CSF, and it is generally reducible because it is communicating with the intracranial cavity. All these signs are generally negative in a nasal glioma. Glioma is a nipped off portion of the encephalocele. In this, 60% can be extranasal, which can present as a firm subcutaneous swelling on the bridge, side of the nose or near the inner canthus. 30% can be purely intranasal, while 10% can be both intranasal and extranasal. Extranasal gliomas are encapsulated and they can be easily removed. RHINOPHYMA or a potato tumor. RHINOPHYMA is hypertrophy of the sebaceous glands in cases of long-standing acne rosacea. It mostly affects the man past the middle age. It causes slightly unsightly appearance because there is obstruction to breathing and vision, and the whole facial structure does not look good. The treatment involves paring down the bulk of the tumor with a sharp knife or a carbon dioxide laser, and then the whole area is allowed to reepithelize. This is because of the sebaceous glands that are present, and thus when you remove them, there is no more hypertrophy of the sebaceous glands. So, in diseases of the external nose, the most important were the meningoencephalocele, the choanal atresia and the rhinophyma. Thank you.